10 signs of cancer growing in your body. Cancer is a word that no one wants to hear, but knowledge is power and enables you to advocate for yourself. Cancer occurs when abnormal cells in the body start growing uncontrollably. Unlike normal cells, which grow, divide, and die as expected, cancer cells keep dividing even when the body doesn't need them. These cells can form masses, known as tumors, and over time they can spread to other parts of the body. They can develop almost anywhere, from the blood to bones, organs, as well as tissues. The process is often slow at first, which is why many cancers go unnoticed until they've grown or spread. The reality is that catching it early can make all the difference. In this video, we'll explore 10 key signs that cancer might be growing in your body. By understanding these signals, you can take charge of your health and seek medical advice when it matters most. When you're aware of the potential warning signs and symptoms, you're giving yourself the best chance at early diagnosis and treatment. Quick reminder, we are not doctors. This video is for information purposes only. If you are experiencing a medical condition, don't hesitate to speak with your doctor. Let's jump right in. Number 1, changes in urinary or bowel habits. When your bathroom habits start to change unexpectedly, it can be your body signaling something more significant is happening. This could include frequent diarrhea, constipation, or even a noticeable change in the shape or size of your stool, such as it becoming thinner. In addition, if you're experiencing blood in your stool, ongoing cramps, bloating, or discomfort in your abdomen, it might indicate colon cancer. On the urinary side, feeling the urge to go more often, experiencing pain while urinating, or seeing blood in your urine might be a sign of cancer in your bladder, kidneys, or other parts of your digestive system. Now, these symptoms may have other causes, such as infections or dietary changes. But if you notice any unusual or continuous changes in your bathroom habits, don't hesitate to reach out to your doctor. Number 2, a cough or hoarseness that won't go away. A lingering cough or hoarseness might seem harmless. However, when these symptoms persist for weeks on end, or if it's getting worse over time, it's important to get it checked. Hoarseness that doesn't improve, particularly if you're not sick, can be an early sign of cancers in the throat or the larynx, otherwise known as the voice box or the thyroid gland. A persistent cough that just won't quit, especially if you're not recovering from a cold or flu, can be a sign of something more severe. This is especially true if you're a smoker or have a history of smoking. Lung cancer, throat cancer, and other respiratory illnesses can sometimes present with a constant cough or hoarseness as early symptoms. So, if you're dealing with a cough or hoarseness that just won't go away, give it your full attention. Before we move on, can we ask for a quick favor? If you're finding value in this video or any of our other videos, please give it a thumbs up and hit that subscribe button. Your support means the world to us, and it helps us keep bringing you content you'll love. Thank you. All right, up next, number 3, mouth sores that won't heal. Let's talk about something you might not expect, mouth sores and their potential link to cancer. We've all had those annoying canker sores that pop up every once in a while, right? They can be quite a nuisance. They're painful, but they usually clear up within a week or so, without causing much concern. Most mouth sores are usually harmless, but lingering sores that last longer than 2 weeks or keep coming back are a different story. Do not ignore any sores, lumps, or patches of red or white in your mouth that don't heal. It could be a sign of oral cancer, which affects the lips, tongue, cheeks, and other areas of the mouth, especially if you smoke, chew tobacco, or drink alcohol regularly. Other warning signs include pain in your mouth, difficulty swallowing, or a feeling like something is caught in your throat. Catching oral cancer early greatly improves the chances of successful treatment and recovery. So if you have any unusual sores or growths in your mouth that are causing you concern, please pay keen attention and address them. Your doctor can examine the area and, if necessary, recommend a biopsy to rule out anything critical. This step is crucial for your peace of mind. It's better to be safe than sorry. Number 4, blood in urine or stool. Blood in your stool or urine is one of the most alarming symptoms, and it's something that you should watch closely. Blood in the stool might be bright red or darker, resembling tar. I know it's not the most pleasant topic, but seeing blood where it doesn't belong is a big deal and could be a warning sign of several types of cancer. Even though blood in the stool can be caused by hemorrhoids or infections, it can also be a symptom of colon or rectal cancer. And blood in the urine, called hematuria, might indicate bladder or kidney cancer. So if you notice any blood in these situations, even if you're not in pain or it's just a small amount, it's enough reason to see your doctor. Number 5. Extreme fatigue, even after getting plenty of rest. Feeling tired is normal, especially after a long day or a poor night's sleep. However, the kind of fatigue that might be linked to cancer is different. It's not just feeling sleepy or worn out. It's a deep, overwhelming exhaustion that doesn't go away, no matter how much rest you get. This extreme fatigue happens because cancer can affect your body in several ways. Cancer cells compete for energy. These cells are like energy vampires. They multiply rapidly and consume a huge amount of your body's energy stores. They can use up the nutrients and energy your body needs for daily activities, leaving you feeling drained. Cancer cells can also disrupt blood production. If your body isn't making enough healthy red blood cells, which carry oxygen, then it can lead to anemia. Anemia happens when your muscles and organs aren't getting enough oxygen, making you feel weak and tired all the time. Apart from that, cancer can cause inflammation in your body. When your body is inflamed, it can produce chemicals that make you feel fatigued. Your immune system is working overtime to try and fight the cancer, and this constant battle can leave you feeling exhausted. This kind of persistent, unfamiliar fatigue can actually be a symptom of various cancers, including leukemia, lymphoma, and colon cancer. Hear me out. I'm not saying that every time you feel tired, it means you have cancer, but it's important to be aware of the potential connection. Being informed can make a big difference. Number 6. Bruising without obvious cause. Bruises happen when small blood vessels called capillaries break under the skin, usually because of an injury or bump. The blood from these broken vessels leaks into the surrounding tissue, causing the familiar black and blue marks associated with bruising. Normally, these bruises fade away as the body heals. But what if you're noticing bruises and you can't remember hitting anything? It can be puzzling. If you start noticing bruises without any obvious cause, particularly if they appear easily or in unusual places like your back, chest, or hands, it's something to watch closely. Certain types of cancer, particularly those that affect the blood and bone marrow, can interfere with your body's ability to form clots and stop bleeding. Leukemia and lymphoma are cancers of the blood and lymphatic system. In leukemia, for example, the bone marrow, which is where blood cells are made, produces too many abnormal white blood cells. This overcrowding can reduce the number of platelets, causing a condition known as thrombocytopenia. Without enough platelets, your blood can't clot properly, leading to easier bruising and bleeding. Next, number 7, weight loss without trying. There's a difference between intentional weight loss through diet and exercise and unintentional, unexplained weight loss. Losing weight without trying, particularly if you've lost more than 10 pounds in a short period, is something to take seriously. While weight can fluctuate naturally, a significant loss without a clear reason, especially if you're not actively trying to lose weight, it's something to be concerned about. Here's how cancer might be involved. Cancer cells are hungry cells. These cells grow and increase quickly, and to keep up with that fast growth, they need a lot of energy. These cells can start using up your body's energy supply, leaving less for your normal bodily functions. As a result, your body may start burning more calories than usual, leading to weight loss. Additionally, some cancers can cause your metabolism to speed up, which means your body burns calories faster than it normally would. This can happen even if you're eating the same amount or more than usual. Some cancers can release substances that affect your appetite and further contribute to weight loss. It can be a sign of several types of cancer, including cancers of the pancreas, stomach, lung, or esophagus. Not only that, your body might react to cancer by releasing chemicals that break down fat and muscle, contributing to weight loss. This is part of your immune system's effort to fight off the disease, but it can lead to a noticeable drop in weight, So, if you find yourself going down a pant size or two without trying, don't just brush it off. Instead, check it out. Number 8, new or unexplained pain. When things go wrong, our bodies have a way of letting us know when that happens. One of the most common ways? Pain. Experiencing aches and pains ever so often is nothing out of the ordinary. But new pain that doesn't seem to have a clear cause, or pain that is severe, lingers, and worsens, or if it's in an area where you don't usually feel pain, can be your body's way of telling you that something isn't right. When it comes to cancer, there are a few reasons why you might start experiencing new or unusual pain. Cancer pain can occur for a number of reasons. As a tumor grows, it can put pressure on nearby organs, nerves, or bones. This pressure can cause pain in the affected area. For example, a tumor pressing on a nerve might cause back pain, or a tumor in the abdomen might lead to stomach pain. If cancer metastasizes, in other words, spreads to other parts of the body, it can cause pain in those areas. For instance, if cancer spreads to the bones, it can lead to bone pain, which might feel like a deep ache or sharp discomfort. Cancer can cause inflammation in the body, which can lead to pain. Inflammation is your body's response to something harmful or irritating, and when it's linked to cancer, it can cause discomfort in the affected areas. Sometimes the body's attempt to fight cancer can cause pain. For example, if your immune system is attacking cancer cells, it can lead to inflammation and pain as a side effect. But if you have new pain, especially pain that's persistent, severe, or doesn't respond to over-the-counter remedies, it's important to take it seriously. Number 9, let's talk about headaches. Stress, lack of sleep, and maybe one too many cups of coffee can cause us to get headaches occasionally. But here's the thing. If you're experiencing constant headaches, especially if they're different from your usual headaches, it should send off warning bells. Of course, not every headache is a sign of brain cancer. However, persistent headaches, especially if they're severe or accompanied by other symptoms, they could potentially be a warning sign. Here's why. One of the more well-known ways that cancer can cause headaches is through brain tumors. As a tumor grows in the brain, it can increase pressure inside the skull. This pressure can cause headaches that might be different from the headaches you're used to. They might be more intense, frequent, or accompanied by other symptoms like nausea, vision changes, or weakness. Sometimes, cancer from another part of the body can spread to the brain. This is known as metastasis. When cancer spreads to the brain, it can cause new headaches or make existing ones worse. These headaches are often persistent and may not respond to typical over-the-counter headache medicines. Even if cancer isn't directly in the brain, it can still cause headaches. For example, cancers of the lung or breast can sometimes lead to a condition called paraneoplastic syndrome, where the body's immune response to cancer affects the nervous system, potentially leading to headaches. If you experience headaches that are concerning, don't hesitate to get it checked out. Your doctor can help determine the cause and recommend the best course of action. Number 10, fever and night sweats. A fever is your body's natural response to an infection or illness. It happens because your immune system is trying to fight off invaders like bacteria or viruses. But sometimes, fever can also be a sign that cancer is present. When fever or night sweats persist without a clear explanation, it's important to zero in on it. Some cancers, like leukemia or lymphoma, can cause frequent or constant fevers. These types of cancer affect your blood and immune system, making it harder for your body to fight off infections. If you're experiencing unexplained fevers that come and go or stick around for a while, especially without any obvious reason like a cold or flu, doesn't mean you should panic, but it's definitely something to discuss with your doctor. Night sweats are another sign that can be easy to overlook. Most of us have woken up sweaty at some point, especially if the room is too warm or after a nightmare. But night sweats related to cancer are different. They're not just about being hot. They can be drenching and happen even when the room is cool. Cancers like lymphoma are known to cause these kinds of intense night sweats. In these cases, your body might be responding to cancer cells in a way that triggers sweating, especially during sleep. If you're experiencing night sweats regularly, to the point where you need to change your clothes or bed sheets, it's worth getting checked out. Now, here are some additional tips. When it comes to cancer, there are a lot of myths and misconceptions that can make it even scarier than it needs to be. Let's clear up a few of the most common ones. Myth 1: all tumors are cancerous. One of the biggest misconceptions is that all tumors are cancerous. This isn't true. Tumors are simply masses of tissue, and they can be either benign, which means non-cancerous, or malignant, meaning cancerous. Benign tumors don't spread to other parts of the body and are usually not life-threatening. Malignant tumors, on the other hand, can invade nearby tissues and spread to other parts of the body, so it's important to get any tumor checked by a doctor. Myth 2: cancer is always a death sentence. Hearing the word cancer can be terrifying, but thanks to advances in medical research and treatment, many people with cancer go on to live long and healthy lives. Early detection and new treatments have made many types of cancer more treatable than ever before. While some cancers are more aggressive and harder to treat, others have high survival rates, especially when caught early. Myth 3: only smokers get lung cancer. While smoking is a major risk factor for lung cancer, it's not the only one. People who have never smoked can still get lung cancer due to factors like exposure to radon gas, secondhand smoke, and certain environmental toxins. It's important for everyone to be aware of the signs of lung cancer, regardless of whether they smoke or not. By debunking these myths, we can reduce the fear and stigma surrounding cancer and help you make informed decisions about your health. Understanding the facts can empower you to take action, seek early treatment, and approach cancer with the knowledge needed. Thanks for watching. We hope this video has been informative. If you found it helpful, hit the like button. Please remember to comment, share, and subscribe for more. Until next time, take care of yourself and each other.